Hi, my name is Sam. I'm going to be your student nurse today. Today we're going to be doing a head-to-toe assessment. Can you tell me your name and date of birth?
Katie Wyman, 11/21/96.
And can you tell me where we are?
We are at the hospital.
And can you tell me what day of the week it is?
It is Thursday.
I'm going to ask you a couple other questions. Do you have any family history of lung cancer?
Nope.
Are you experiencing any shortness of breath?
Nope.
And do you experience any pain when you're working out?
No.
Okay. So as I'm looking at my patient, I noticed that she's alert and oriented ×3. Her skin tone is accurate and even for her race and age. She has an upright posture, seems to be relaxed. I don't notice any wounds, drains, or dressings. Her hygiene seems to be good with no body odors, and her breathing seems to be relaxed. I'm going to go ahead and I'm going to start my cardiac assessment. So I'm going to feel your temperature, capillary refill here, temperature, cap refill. Okay, as I'm doing that, her cap refill is less than 2 seconds. I notice that her skin is dry and warm to touch, and her I don't notice any edema. So I'm going to go ahead and I'm going to look at your neck real quick. Can you tilt to the side for me? Okay. No DVT is present. I'm going to go ahead and feel your carotid artery. Okay, and I'm going to listen with the bell side of my stethoscope. Okay, and I don't hear anything. So I'm going to go ahead and I'm going to feel your pulses. I did notice that it was +2 pulse up there. Brachial. Radial. I would feel the femoral, which is on the inside of the ground, but we're not going to be doing that. Popliteal behind the knees. Dorsalis pedis, which is on top of the foot. And posterior tibia. Okay, and I feel pulses bilaterally equal with a +2. I'm going to go ahead and listen to your heart now. I'm going to listen with the diaphragm of the stethoscopes first. I go underneath. Now I'm going to listen with the bell. Okay, I hear both S1 and S2 with no extra heart sounds or murmurs. Her blood pressure was 120/78, with her pulse also being 84, which are both within normal limits. So I'm going to go ahead and start my musculoskeletal assessment. Can you put your arms out for me? I want you to pull towards you, then towards me, wrists out, up, and down. Can you squeeze my hands for me? Okay. I want you to pull towards you, push against me, push your feet up and down. She has a muscular strength of 5 out of 5. I'm going to go ahead and start my neuro assessment. So I'm going to have you read my badge for me.
Mount Secours Memorial College of Nursing, Samantha Smith.
Okay. Cranial nerve 2 is intact. Now I'm going to have you look straight ahead for me. Okay, and I want you to focus on my finger, then on the wall. Okay, and I want you to follow my finger without moving your head. Okay, cranial nerve 3, 4, and 6 are intact. I'm going to have you clench your jaw for me, and then close your eyes, and I'm going to touch the cotton ball to your face, and I want you to tell me where you feel it.
Forehead. Left cheek. Right cheek. Chin.
Okay. Cranial nerve 5 is intact. I'm going to go ahead and have you smile, then frown, puff your cheeks, raise your eyebrows. Okay. Cranial nerve 7 is intact. I'm going to have you stick out your tongue and say, ah.
Ah.
Okay. Cranial nerve 9 and 10 are intact. I noticed that her uvula is midline. And because we're able to communicate and it's at an even understandable rate, cranial nerve 8 is intact. So now I'm going to have you push up against my hands and then push towards my hand, push. Okay. Cranial nerve 11 is intact. And now I'm going to have you stick out your tongue and move it side to side. Cranial nerve 12 is intact. So now I'm going to go ahead and start my respiratory assessment. I'm going to start by listening to your lungs, okay? I want you to take a big breath. Ready? Big breath. Big breath. Big breath. Big breath. I'm going to go under. Big breath. Big breath. I'm going to listen laterally. Big breath. Okay. Big breath. And can you turn around for me real quick? Okay. I want you to do big breath. 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 Okay. I hear normal breathing sounds. It's effortless, and I don't hear any adventitious sounds. Her respiratory rate was 16, so that is within normal limits. I'm going to go ahead and I'm going to start my GI assessment. When was your last bowel movement?
This morning.
Okay, so I'm going to go ahead and have you lay down real quick for me. And as I'm looking at the appearance of her stomach, it is flat. I don't notice any wounds, masses, drainages, or any distension. I'm going to go ahead and I'm going to listen first in all 4 quadrants. Okay. Okay, and I'm going to listen with the bell down the center. Okay, I don't hear any vascular sounds, but I do hear active bowel sounds, about 15 within each quadrant. I'm going to go ahead and I'm going to start some palpating. I'm going to start with light, then deep. Let me know if you are experiencing any pain. Were you experiencing any pain?
Nope.
All right, going to go deep now. Okay, upon touching her, I noticed that I didn't feel any masses or organs out of displacement, and she did not experience any pain. So you can go ahead and sit up now for me. And I'm done with my assessment. Is there any other questions you would like to ask?
Nope.
Okay. All right, that's it.